Ben Fuson from Superior Physical Therapy. Today we're going to talk a little bit about epicondylitis in our elbow, or what we hear as tennis elbow or golfer's elbow. Usually this is a medial, meaning the inside of our elbow, or lateral pain. A lot of treatment, traditional treatment in PT is focused on that area, calming down the inflammation there, trying to correct something that's going on in that elbow. The reality of it is that elbow is just being told what to do. It's being told what to do by the shoulder and also by our hip. So here at Superior Physical Therapy, what we tend to focus on is where are our deficits elsewhere. A lot of times that shoulder either has too much or too little movement, and to control a racket swing, let's say with tennis elbow, controlling a racket swing, if that shoulder's not being compliant and doing what it needs to do during that swing and controlling motion, decelerating motion, your elbow is going to have to do it. That elbow is not designed to move very much. It's pretty much just a hinged joint. There is a little bit of side-to-side motion there, but not a lot. Another aspect that we like to look at is our thoracic spine. How does that thoracic spine move around when we're doing a racket swing, any direction, when we're doing a golf swing? Huge motion here in the middle of our spine. Thoracic spine is the middle of our back. Lots of motion there when we need to do an active sport that requires swinging of our arms. Again, a lot of control there to decelerate a motion, whether we're winding up or whether we're following through, whether that be tennis, golf, anything like that. Another big aspect is our hip. Our hip, when we swing through, our hip activates. It lengthens that whole section of our body. So when that happens, that hip is asked to control a lot of motion as we swing and follow through there. It's decelerating a lot of motion with our upper trunk moving over top of it. Big time there. We can even go further away from the elbow and look at our foot and ankle, how that's being compliant with the ground, if that's functioning appropriately, to turn that hip on, to allow us to use that hip appropriately when we're swinging and doing active motion. So, kind of to summarize, a lot of people that play racket sports or golf have a lot of elbow pain. And you'll see a lot of treatment directed right there. A lot of those little cuffs that go around the elbow. And that's really just kind of redirecting attention somewhere else. It's kind of putting a band-aid on it. What we look at here is how does the rest of that body move around to control the motion of that arm, when that arm's just kind of not asked to do a whole lot and we're overstressing it. So what else in the chain of motion can we look at to correct that? So if you have lateral, medial, any sort of elbow pain with any activity, it doesn't have to be a sport, any activity throughout your day, come see us here, see what we can do for you. We'll provide some good insight into how we move around during those activities. Thanks a lot.